Hey everybody, talking a little bit more about extensor hallucis longus tendinopathy. This is really similar to sort of our first MTBJ protocol, but really it's about focusing more into that local area within the hallux too. What I'm typically doing is really at that insertion, or that distal insertion as we're coming on to that distal phalanx of the first, hitting that medial and lateral aspect. And then I'm also going to put a few more into that sort of maybe medial. There might also be one in that sort of, mid-proximal phalanx aspect, sort of in between these two, but really then hitting at that joint level to really free up any adhesions that are occurring as it's connecting onto the base of the, at the capsule of the first MTBJ, at the base of that proximal phalanx. And then of course we're just tracking it back. Obviously there's going to be some sensation coming from that deep perineal nerve, so we want to be mindful of that and into that first interspace, but otherwise we're really coming up that medial dorsal cutaneous nerve into our superficial perineal to whatever levels we may need to. Now typically for this condition I'm not needing to do too much sort of in this area, but where I can, I do want to try and release as much of that EHL sort of muscle belly as we're getting into our lower leg here, but really these are the type of patients that respond quite well, but it can take an overnight for it to settle down, and because it's such a confined area, that fluid's really quite thick, people sort of go, I don't really know how it is during the consult, and it can be a little bit disheartening. But these are the type of patients, when you see them a week afterwards, they say actually that worked quite well. Typically we only need to do one, maybe 2 sessions. I've never done a full 5 sessions for this condition because people do respond quite well. Tolerance wise, varies a little bit. Some people will tolerate it a bit better than others. Again, putting a bit of Hyperfix on there for that stability is a really nice thing to do as well. But just realizing and educating our patients that it does take a little bit more for it to settle down and for you to feel that benefit. Of course, we're doing our normal strengthening, some resistance strengthening, laser therapy beforehand, like I said, the Hyperfix, and do consider whether maybe a platelet-rich plasma could be an option as well, seeing it's a tendon there. But I personally, I'd go for the Lyftogt Prolotherapy any day of the week because it works quite well. But hopefully this has given you a little bit more information on my protocol for extensor hallucis longus tendinopathy. Cheers.